Someone this intelligent cannot keep moving the target and then be surprised when people start to become frustrated and belligerent. Today's discussion is, what does a sick population that doesn't trust the medical guidance of its health officials look like? Now take a seat. We have a lot to talk about. A little over a year ago, Dr. Fauci appeared to be the voice of reason, one of the few calm voices in a world on fire. Revered so highly, some canonized him, some memorialized him into their flesh, and others mistook him for God. But the more he talked, the clearer it became that he'd not only lost a thread, but had begun his most recent relationship with the nation on his back foot. Here's him recounting his statements last week.
Okay, at the time, three things were going on. We were told very clearly at the coronavirus task force, including by the Surgeon General, who's a good person all the way, that there was a clear shortage of masks. And if we went around recommending masks, the healthcare providers who were putting themselves in harm's way every single day would not have enough.
Now, the country's not made up of epidemiologists, but the majority of Americans had a problem with nearly each of his points. To start, in retrospect, many Americans were insulted by the fact that rather than inform them of the potential danger of the virus, he robbed them of the opportunity to protect themselves and their loved ones, lying to the entire country to prevent a run on PPE. He then went on to say,
Point number two, there was no evidence at the time that masks outside of the setting of the hospital worked. There were no data to show that.
When this was first said last March, you could hear a chorus of Americans, each with an ounce of common sense, ring out. Data? What data could you possibly need? If a mask works inside of a hospital setting, why wouldn't it work outside? Wondering aloud, do masks suddenly become porous when not worn by a nurse? Not to mention that just earlier in this broadcast, he mentioned being fully cognizant that the Chinese, who dealt with another coronavirus, SARS, before, were wearing masks at a higher rate than usual. And it wasn't for decoration.
Now, when you see people and look at the films in China and South Korea, whatever, everybody's wearing a mask.
But for some reason, we Americans don't need them.
Right now in the United States, people should not be walking around with masks.
And his last point was a claim that he and other professionals in the field didn't know at the time that 50% of cases were being spread asymptomatically by people that had no symptoms. The CDC has plainly stated that they don't know how many cases of COVID-19 are asymptomatic. So for him to say that half of infections spread were asymptomatic is a fabricated statement. Despite this, I and millions of other Americans continue to listen to him. For the last 30 years, Dr. Fauci's been a trusted source in public health. From leading the charge at the height of the AIDS crisis in 1984 to the Ebola outbreak in 2014, every interaction Dr. Anthony Fauci has had with the public has been positive. Why he then chose to start this relationship with dishonesty is beyond me, but the ramifications of that decision are not. When people began to realize he'd advised them against their own best interest because he felt they couldn't be trusted not to hoard N95s, perception of him began to slip. And after that, his fall from favor wasn't a short one. As he went from telling people that masks weren't necessary to his firm stance that people should be wearing too, his position went from trusted leading expert to fear-mongering propagandist. And those he hadn't lost while walking around vaccinated and double-masked abandoned him when he told people that even after their shots, they essentially had to live their lives as if they hadn't received them. Someone this intelligent cannot keep moving the target and be surprised when people start to become frustrated and belligerent. The majority of Americans were willing to do anything he told them in order to return to the life they lost over a year ago. But every time he moved the goalpost, Americans lost more and more confidence in him, ultimately resulting in them doing whatever makes them happy, and no longer looking to him for vital information, suddenly seeing him as a man that can no longer be trusted. And it's that erosion of trust that lies at the heart of the matter here. What Fauci says or does doesn't really matter at this point. He's essentially poisoned a portion of Americans against him. Unfortunately, he's not only poisoned himself, but the ground that he stands on. And when the next pandemic strikes and people hear Director of National Institute of Allergy and Infectious Diseases, they'll be more inclined to continue scrolling or change the channel than they were before Dr. Fauci stepped into his position. The damage that he's inflicted on his reputation isn't important in the long run. When the virus passes and he's no longer in the spotlight, history will look back on his 30+ years of service to this country with respect. But when the next pandemic rolls around and we meet the next director of NIAID, trust will have to be rebuilt. Whoever sits in that chair after him will have to work hard to ever be believed. And when people can't trust their head of infectious disease during a pandemic, our country will be on its knees. Now that we're all caught up, take a seat down in the comments below and let's talk about this. If he lied to us last year, we all have a reason to be upset, and people souring on him and his recommendations make complete sense. But if he was telling the truth, we end up in the same place, with a society that doesn't know whether their health is the first priority of their director of infectious disease or something else is. Leading today's question to be, do you think that people's distrust in him may lead to a broader distrust in public health officials? And if it does, what does a sick population that doesn't trust the medical guidance of its health officials look like? Feel free to share this with someone who could benefit from a new perspective, or whose contribution could broaden our understanding of the situation as we continue our search for dissent.